Hi and welcome to Hoxton Therapy. This is a narration of one of our articles. Trauma. It is normal for any human being to experience trauma and have to start coping with trauma if a traumatic event has occurred. As a result, there are all kinds of physical and emotional reactions that occur because of this. Trauma can happen to anybody. Whether that be an adult or a child, it can strike at any time. In this article, we will have a look at some of the ways that can assist you in dealing with trauma. We will also discuss how parents can assist children who have been traumatised. So, how can trauma be dealt with? Number 1. Accept your trauma. Coping with emotional trauma. The first thing you need to do when coping with trauma is to acknowledge that you have experienced a traumatic or horrifying event or situation. Be prepared to make sure you do not get angry and be ready to react in a harsh manner. Stay away from thinking too much about what could have happened if you did something else. Don't wish it upon another person. Just keep to the fact that this has actually happened. If you accept the situation or event as it is, it'll be much easier to heal. Number 2. Get involved with positive activities. Once you have accepted the event or situation, distract yourself from concentrating and getting involved with worthwhile activities. This will help relieve any pain or bad memories you have may be experiencing. Not only this, there are special exercises designed to get your nervous system active again. These exercises might include games, swimming, walking, massage or dancing. Keep as busy as possible with any positive activities. Bad thoughts or memories will soon start to disappear. Number 3. Relax yourself. Practicing relaxation is often recommended by medical doctors when you're coping with trauma. Begin by taking 10 deep breaths when you are angry or upset, even when you are not. Other techniques for relaxation include music, prayer, yoga, massage, or stretching. These are very beneficial to your body. You will become more peaceful, your nervous system will begin to readjust to the changes going on. Relaxation techniques can also help you to lessen any negative reactions you may be experiencing. Number 4. Talk to people. When experiencing trauma, it is a good idea to tell family members or friends or others who are also coping with trauma, preferably in a group therapy session. Be open with what you tell them and you will receive their support. However, never isolate yourself. Tell those whom you trust and who understand you. Do your best to mix with others as much as you can. As you express your feelings, the painful memories will soon be relieved. Writing your feelings down is another good way of expressing them. Do this at a high point when you write. This way you can take more control over your emotions as time goes on. Number 6. PTSD triggers years later. Trauma recovery does not happen at the drop of a hat. It can take a long time to heal. Always be patient when coping with trauma. There will always be times where you will be experiencing a phobia or panic. Taking drugs or drinking may also occur. Be tolerant of yourself. If you are a parent who has a child experiencing trauma, here are some ways you can help deal with this. Number 7. Give your child comfort and solace. Always remember the age of your child and what their individual needs are. Discuss the traumatic event with them. Do this as openly and as honestly as possible. Give your child opportunity to ask questions and talk about how they feel. Provide security and safety for them. Keep routines as normal and consistently as possible. They will help your child to realise that they are secure and soon have a normal life again. Number 8. Looking after the requirements of the child. Every child has different requirements. The same goes with dealing with trauma. Some may need a lot of hugs, others will depend on you. Discussions to help them become more comfortable may also be required. Be sure to be as sensitive as you can to your child's requirements. Don't worry about clingy behaviour. Let the child have their favourite teddy or their blanket. The actions of the child often show they are fearful and anxious. Accepting their requirements is a must. Number 9. Be patient when coping with trauma. Many children will ask the same question repeatedly, particularly when they are insecure. Always be patient as you can. Always be as patient as you can with them and answer questions as simply and as honestly as you can. Let the child tell you how they are feeling. Be sure they feel comfortable in your company. Number 10. Keep social media away from children. Trauma can often occur from social media or other media sources. These include the television, the internet and radio. If these are on and a child can see such things, it will be harder for children to deal with trauma. Older children can become more misled or frustrated. It is advised that these things are kept away from children as much as possible. Don't watch, listen, or read anything when children are around. 11. Teach and show your child how to manage. Helping children who have experienced traumatic events will also help them to deal with negative emotions. Try to distract them from the negative emotions or thoughts. Do this by getting them involved in positive activities. These include painting or dancing. Encourage the child to play outside. Distracting them will keep their mind off the trauma, and their mind and body will be kept active. If a parent is having difficulty with any of this, it is okay to seek outside assistance. Professional assistance from a counsellor may be the right approach in helping your child overcome trauma. In this article, we have seen that trauma can affect adults and children. It can occur at any time. To deal with trauma, as an adult, you can accept the trauma for what it is, get involved with positive activities, practice relaxation techniques, talk to others, and be patient. With children, you can give the child solace and comfort, look after their requirements, be patient, keep them away from social media, and teach them how to manage. If you cannot do this yourself, it is okay to seek professional help from a counsellor or therapist. Hi, we hope you enjoyed that narration of one of our articles on our website, hoxtontherapy.com. As usual, we have our podcast which answers your question, and the name of the podcast is the Ask Hoxton Therapy Show. You can ask us questions on social media, and we will answer those questions in upcoming either video content, and of course when our video content's done, our podcast content audio is done as well. So stay safe out there. It's COVID-19 at the moment. Till next time, goodbye. Never act on any advice given in these articles, videos or audios. Always seek professional help before acting on anything you read or watch or listen to on this website, or in our podcast, or on our YouTube channel, or anywhere on our social media.